A shoulder replacement, we start that conversation in the setting of someone that has arthritis in the shoulder, and that arthritis can come about for different reasons. You can get routine osteoarthritis of the ball and socket joint of the shoulder, and then the surrounding rotator cuff is working just fine, the surrounding muscles and tendons are working fine, but you just have a bad joint and it's really worn out. That would be an indication to do what we call an anatomic shoulder replacement, where we are replacing the ball and socket joint in the typical anatomy that is already there. The components are made of metal, and then there's some smooth plastic components as well. There are situations where you can develop arthritis from a chronic rotator cuff tear. So say that you had a bad rotator cuff tear and it just never got treated, or you really weren't having much problems with it. Eventually what will happen is you will get arthritis in the ball and socket joint because of that chronic rotator cuff tear. Over time, the ball and socket joint wears out, and it may get to be where it's quite painful. The other challenge is when you do have a chronic rotator cuff tear and arthritis is you may have some difficulty with moving your arm above your head for both reasons, the arthritis and that chronic rotator cuff tear. That would be a situation where we could also do a shoulder replacement. The design of that shoulder replacement will be a little bit different. We call that a reverse total shoulder replacement. Reverse meaning that the socket and the ball are really reversed. Instead of the socket being on the socket side, it's on the ball side. Instead of the ball being on the ball side, it's on the socket side. From the outside, no difference. X-ray, you'll see a difference, and certainly when we're in surgery, we know what we're doing to put the ball on the right side for a reverse. The whole idea of a reverse shoulder replacement is we're changing the center of rotation. It's for mechanical reasons. By changing or altering that center of rotation, by reversing the ball and socket joint, we are allowing the deltoid muscle to have a greater mechanical advantage. The reason why we're doing a reverse is because the rotator cuff, which is the combination of muscles and tendons that help move your arm above your head, is no longer working. Without that rotator cuff, if we do a shoulder replacement, an anatomic shoulder replacement, you may still have some challenges with that motion because you don't have a functioning rotator cuff. If we ask the deltoid to do more work, then we can get more motion. One way to ask the deltoid to do more work is by creating a mechanical advantage for that deltoid to move the arm. That's the idea of changing that center of rotation. If we can change that center of rotation, that deltoid has a better fulcrum to pull against, and that can compensate for that rotator cuff tear that you may have.